Most people think sleep is just about taking rest, but it's a secret weapon against blood pressure, heart disease, and stroke. Today's video, I will go through about the importance of sleep in heart health and give some practical advice to you as how to improve the sleep quality so that we can avoid heart-related ailment. As a practicing cardiologist at various institutions, I have seen lots of my patients, cardiac patients whose heart condition has worsened because their sleep was poor. So sleep and heart health has a bidirectional relationship. That means poor sleep contributes towards heart health, and at the same time poor cardiac condition leads on to decreased or inefficient sleep. So it is a bidirectional relationship, and many of those heart disease or heart condition gets worsened by a poor sleep. So what is the link between sleep and heart health? Poor sleep contributes to increased risk of stroke. Poor sleep also contributes to increased risk of heart attack and heart blockages. Poor sleep contributes to elevated blood pressure. So what happens during sleep? During sleep, especially during deep sleep, our blood pressure comes down around 10 to 20%, and even our heart rate also decreases. So this is the way our repair mechanism of the body takes place. During daytime, we are stressed, we are anxious, our heart rate gets elevated, our heart is pumping faster, and our BP is higher. And during sleep, our heart goes into the resting mode. Our heart rate decreases, our blood pressure decreases substantially. So heart gets rest during sleep, especially deep sleep. And sleep also has an effect on inflammation. Inflammation is a condition where it damages the body, especially the chronic inflammation. It damages the blood vessels, and it is nowadays thought that chronic inflammation is the root cause behind the chronic diseases, and sleep helps in decreasing the chronic inflammation. Sleep decreases the stress hormones like cortisol or adrenaline. Thereby, it gives protection against the stresses on the heart. And sleep, by decreasing the stress hormones, also improves the metabolism. So thereby, it helps in blood sugar regulation, it helps in the cholesterol and triglyceride regulation. So by dint of all those mechanisms, a good sleep actually is helpful in decreasing the blood pressure, decreasing the inflammation, maintaining a proper metabolism, maintaining a good weight, blood sugar regulation, as well as cholesterol and triglyceride regulation. So that's why it is thought that sleep is the nature's best medicine, because as we have discussed, it helps in modulating the BP, decreasing the BP, maintaining the BP the normal level. It has a metabolic benefit by helping us reducing the body weight and cholesterol triglyceride metabolism, decreasing the inflammation. None of the medicines what we prescribe can control all those things together. Like none of the medicine, we usually give medicine for blood pressure, we give medicine for blood sugar, we give medicine for weight reduction or inflammation reduction, but none of the medicine can take care of all those things at a single time. But sleep can do that on its own. So that's why it is nature's best medicine. What is the optimum duration for sleep? It varies depending on the age of the person. On an average, optimum sleep duration for an adult is around 7 to 9 hours. Especially in case of children, actually it is more, it could be 9 to 14 hours also. But for an adult, it is around 7 to 9 hours of uninterrupted good quality sleep. There are major two sleep disorders which can affect our health. One is chronic insomnia, where we tend to have sleep disturbances. Our sleep quality is poor or our sleep quantity is hampered. We are sleeping less than 6 hours. Numerous studies have shown if we sleep consistently for less than 6 hours, our risk of various chronic diseases, especially heart diseases and stroke, increases substantially. So this is a chronic insomnia. And second is sleep apnea. Sleep apnea is a condition where a person snores excessively, and because this snoring, there are lots of medical complications which can arise. What is this sleep apnea? Sleep apnea actually is a silent killer. Most of the time, we do not tend to recognize the importance of sleep apnea. We tend to think the person is snoring, that is just part of the routine thing. But what happens during snoring? Snoring, why it happens? Snoring happens because of excessive weight, especially around the neck region. When we sleep, our body doesn't get oxygen properly because the neck muscles and laryngeal muscle, they go into spasm. So our body doesn't get oxygen properly. So it can physically manifest as a snoring. Your partner can tell you that you are snoring excessively, but it can lead on to other complications also. It has various symptoms. Like if a person is excessively snoring, it can lead on to sleep apnea, where body doesn't get oxygen properly, and patient can complain of various symptoms. He can complain of poor or non-refreshing sleep. When he gets up in the mornings, the sleep is not refreshing, or he can get early morning headache, or early morning sore throat, or drying of the mouth. He can get daytime excessive sleepiness. So all those are symptoms of obstructed sleep apnea. So along with these symptoms, if the person is snoring also, along with these symptoms, the person should be taking a doctor's advice, because the person might be suffering from an obstructive sleep apnea or OSA, because OSA is dangerous. OSA can lead on to persistent elevated hypertension. Lots of patients we tend to see whose blood pressure is not under control. The blood pressure is refractory. We give lots of medicine, but still blood pressure is not under control. One of the reasons could be that obstructive sleep apnea, which can lead on to refractory or persistently elevated blood pressure in spite of multiple medication. Along with that, persistent hypertension, obstructive sleep apnea or snoring can lead on to other complications, like it can cause irregularity of the heart rate, which is known as atrial fibrillation, and increases the risk of stroke and heart failure. So that's why prompt recognition of obstructive sleep apnea is important. If the person is snoring along with the symptoms which I discussed previously, the person should go to the doctor and should get evaluated for obstructive sleep apnea. So having said that, the sleep is absolutely important for our body function, for our heart. How to improve this sleep, quality and quantity? There are a few lifestyle changes which you should do to improve the quality. First of all, first thing in the morning when you wake up, you should get exposed to the sun, because when you expose to the sun, especially when you wake up, for the first half an hour or so, it improves your sleep-wake cycle. It primes you to sleep towards the end of the day more efficiently. So exposure to the sun is very important, and early morning exercise also helps in that regard. If you exercise first thing in the morning, go for a walk for half an hour or 45 minutes to 1 hour, it regulates your sleep-wake cycle and you tend to feel sleepy towards the end of the day. So that is something which is very important. Then there are a few evening routines also you need to do. The most important is that you should avoid the screen time, especially the electronic gadgets we actually use nowadays, like mobile, laptop, or whatever maybe, even TV also. You have to avoid using these electronic gadgets 2 to 3 hours before your sleep. You try to avoid that. And your room temperature should be conducive for sleep. It should be noise free or minimal noise as much as possible. Temperature should be good, and you should have a proper wind down before going to bed. You should do some relaxing activities, like you should read a book or listen to some music, or you can do some meditation, some chanting, prayers. So by doing all this relaxing activity before the bed, you can prime yourself to get a good night's sleep. And before going to bed, you can take a warm shower. It has been shown that warm shower promotes sleep. Early morning, you can take a cold shower, which keeps you alert and active, but before bedtime, you can take a warm shower, which promotes sleep. There are roles of nutrition also in sleep. So especially the most important thing is that the timing of the dinner. You should take your dinner at least 2 to 3 hours before the bedtime, because if you take a late dinner prevents the sleep onset. It hampers sleep, it hampers the sleep quantity as well as hampers the sleep quality. Your deep sleep gets affected, and deep sleep is something which is very important for our body. Our body takes rest during deep sleep. As we have discussed previously, deep sleep decreases the heart rate, deep sleep decreases the blood pressure, thereby it has a protective effect on the heart. So take dinner at least 2 to 3 hours before the bedtime. And you can take some sleep promoting foods and beverages which are rich in tryptophan and magnesium. These are the two chemicals which can induce sleep. Magnesium containing foods, like we can take almonds, we can take pumpkin seeds, we can take banana or apricot, which are rich in magnesium. While tryptophan rich foods also you can take, like paneer or almonds. All those things actually promote sleep. And one of the most important aspects as far as having a good sleep is concerned, to avoid tea and coffee beyond afternoon. You can take tea and coffee in the morning, or do not take tea and coffee beyond 2 o'clock, because if you take tea and coffee towards later part of the day, too close to bedtime, tea and coffee actually hampers with your sleep. So try to avoid tea and coffee beyond afternoon. So nutrition and sleep we have already discussed. Few important lifestyle changes which you should do for a good sleep. The most important is to maintain a consistent sleep time and wake time. This is something which people don't tend to realize. Sleeping at the same time every day and waking up at the same time every day is very important, because your body goes into a routine. Otherwise, if your sleeping time and waking time there is a huge discrepancy, then your body gets confused and your sleep also gets hampered in that process. So sleep at the same time and try to wake up at the same time. Half an hour, 15 minutes plus minus is okay, but try to maintain the schedule even on weekends, even on holidays, so that your body gets used to it. And this is one of the most important aspect of sleep hygiene, maintaining a consistent scheduling. And digital detox we have already discussed. We should avoid the screen time at least 2 to 3 hours before bed, and maintaining a good sleep environment and eating habits is another important thing, where we should avoid a heavy dinner. You should take a light dinner and you should take it at least 2 to 3 hours before going to bed, so that our sleep is not hampered. We get a good night's sleep. And light exposure is also equally important, especially light exposure during early morning. We should get ourselves exposed to a morning sunlight, which maintains our sleep-wake cycle, which helps in the production of melatonin towards the later part of the day. And melatonin is a hormone which makes us feel sleepy. So as soon as you wake up, we should get exposed to morning sun, and all throughout the day you should be exposed to the natural light as much as possible. But at the same time, as the day progresses and night approaches, we should avoid bright light exposure, should avoid the screen exposure. You should make the lighting at home dim rather than a bright light. So all those small changes makes a significant impact as far as sleep hygiene is concerned and promoting a good sleep. Physical activity at the same time is very important, especially physical activity during the daytime, during the early morning period helps us getting a good quality sleep. But try to avoid physical activity too close to bedtime, because if you do physical activity too close to bedtime, it hampers sleep. So physical activity is important, but it should be done early part of the day, but not towards the end part of the day. When to seek a medical advice? When you are having persistent sleep problem for more than 3 months, when you have symptoms of sleep apnea, obstructive sleep apnea, like you are snoring excessively, or you are having daytime excessive sleepiness, when you are waking up with a headache in the morning, waking up with a poor or non-refreshing sleep, all the symptoms are suggestive of an obstructive sleep apnea, and you should go and consult your doctor. So the key takeaways as far as sleep is concerned is that most important is maintain that schedule. You should sleep at the same time and wake up at the same time, irrespective of whether it is a Sunday, whether it is a holiday or on a vacation. You should take a light dinner, avoid heavy dinner, and take at least dinner 2 to 3 hours before bedtime. And you should avoid screen exposure, light exposure towards the end part of the day, and do some relaxing activities before bedtime. With all those small adjustments in your day-to-day life, you can augment your sleep, you can get a good night's sleep, so that it protects your heart. Because ultimately, if you sleep well, your health will be restored, your heart will be okay, and you'll be giving your body a proper full night's rest. If you like the video, kindly share and subscribe to our channel, and thank you all for your patient care.